And thanks to everybody for joining us wherever you may be here. It's a little bit overcast, possible storms in the area, but we're going to keep our fingers crossed that doesn't lead to any connection problems. So for those of you who haven't joined us in the past, these are our monthly implementation science webinars where typically, and certainly in this case, we have a pretty relaxed sort of fireside chat format. Where we have a chance really to learn from some wonderful experts. You can see the three of them in this particular order, Sydney, Taryn, and Stephanie, who are joining us today to talk about a topic that's really of interest and of importance to all of us. And so credit to Sarah Bernal from our team, who does have a conflict and isn't able to join us today, for recognizing through all of the work she's done facilitating training about how important it is not just to think about the individual investigator or the individual practitioner, but really thinking about building broader teams to engage in a range of different implementation studies. And so we're relying on our three experts, all of whom are graduates of in past years, some of the training programs that we've been able to do in this space, and all of whom represent different contexts, but that shared recognition of how important it is for us to think collectively about how we advance the field. So we were able to draw upon examples that come from psychiatry, come from depression, among adults, that come from improving child health and development, improving cancer and other chronic diseases across a range of different settings, to just be able to say, how can we do a better job of building teams and building a collective understanding of how we can improve health and how we can improve care through implementation science. So with that, I do want to welcome our three wonderful guests whose smiling faces and whose affiliations and whose bios exist elsewhere, but we're not going to spend as much time lavishing praise except to say that they're three wonderful experts with us today. And we want to start out with a question. By the way, for those of you new to the format, the purpose of this kind of dialogue is to be a dialogue, to get from you the questions that you want to know, basically around this broad topic of building implementation science teams. And as much as you start to influence the conversation through your entry into the Q&A of those questions, we will immediately turn our attention to those. So you drive, but in the meantime, we'll help to set up. And so the first question that I want to ask each of our guests to help set up the conversation is, if each of you, and maybe I'll start with Taryn and then Sydney and then Stephanie in that order, we'll range order, vary order, but can each of you talk a little bit about your sort of earliest exposure to this concept of D&I research as a team sport?
Sure, I appreciate that question. And I'd have to say for myself that implementation science as a team sport, I began to know that as quickly as I began to know what implementation science was. And so I was doing work in childcare settings to try to implement an intervention that was wonderfully designed and co-designed with end users, but we were still having trouble with the implementation. And I needed to understand more about why that was. And that's where I got directed to implementation science. And as that happened, I realized I needed a lot more team members at the table to be able to do qualitative work, to understand perspectives of stakeholders, to get those stakeholders at the table through community engagement efforts, maybe even to think more about diversity, equity, and inclusion in our work so that we were representing the voices that mattered most for our implementation efforts. So for me, it was as quickly as I began to understand implementation science, I could see that, oh gosh, I need a good quality team.
Awesome. Thanks for that. Sydney, you want to jump in with your thoughts?
Sure. And thank you, David, and NCI for putting together this really important panel and discussion today. So my work is really focused on implementing evidence-based interventions into faith-based organizations and other trusted community settings. Most of my work has been done in partnership with predominantly African-American churches. And we were trying to implement evidence-based interventions to try to reduce disparities in care, especially access in those settings. And that is what really drew me to implementation science. I was really fortunate to participate in the Training Institute for research and dissemination and implementation research and help tighter when it was in person for 5 days at WashU in St. Louis in 2013. And it was just a wonderfully diverse group of investigators across disciplines, across specialties, and that really showed the importance of multidisciplinary approaches and really emphasized the importance of teams. The other aspect of teams that really drew to me was the employment of community engaged approaches and participatory approaches. All of our work, we use a community steering council or advisory board, which is a team in and of itself. And so those two kind of tighter and the participatory approaches really show the importance of teams.
Great. Thanks, Sydney. Stephanie, same question for you.
Sure. So thank you, David, and to all of the organizers at NCI for inviting us to be here today. I would say that my first exposure to the importance of this concept was through the Cancer Prevention and Control Research Network about 8 or 9 years ago when I first got involved with this network. CPCRN is a national group of academic, public health, and community partners who are focused on community-based and participatory cancer implementation research across 8 network centers. And as you know, David, it's co-supported through CDC and NCI. And its members include people from public health, medicine, pharmacy, nursing, and beyond. And at one of the very first meetings I attended as an assistant professor, I realized that not only the people who were present, but the people who were speaking at that meeting included not just, behavioral researchers, but, economists and health services researchers like myself, and physicians, nurses, engineers, supportive care staff, community practitioners, community advocates, grassroots organizers. I mean, it was just this amazing group of people that were all there contributing. And I think a light bulb went off and I was like, this is how it's meant to be. It was eye-opening. I felt like as a health services researcher and a decision scientist that I would be out of place in that forum. I felt the same way when I first applied to the MT-DIRC program and eventually was accepted. And then when I got there, it was so clear that I was not out of place, that, I was among colleagues. And I'm increasingly observing that that's true, that disciplinary diversity is sort of intrinsic to implementation science wherever I go.
Right. Thanks again to each of you. And yeah, I think for many of us, as long as we've been engaged in implementation science, recognize that it's just not a sort of sport for individuals, but it really is around the collective. And that points to a question that we hear a lot. And I'd really be curious for each of your takes on it. Maybe we can start with Sydney and then Stephanie and then Taryn. Is how each of you thinks about designing the optimal team, and consider team broadly as you like for a given implementation study or project. So Sydney, do you want to give us your thoughts on that?
Sure. So I think that, so I love the analogy of teams, and I am a huge basketball fan. And I try to think of each of the 5 different players being kind of 5 parts of the team. So I'll highlight the top 5. I think there are more, but I'll highlight the top 5. So certainly I think it starts, with the point guard, whoever your MPIs. Most of my grants are MPI, which I think speaks to the team model. So really identifying, those leaders, and realizing that those leadership roles may shift for different parts of the project. And then we have a mixed methods expert. So someone who really can understand the qualitative and do the qualitative research to understand the perspectives of key stakeholders. Certainly an implementation champion. Again, most of my work is done in partnership with African American churches. So we have an implementation champion for the entire study, but also a champion at each church. So thinking about champions at each local site and then possibly for the study as well. And then a community advisory board. So we utilize a community advisory board for all of our studies, and I think that's a key player. And then I do certainly want to acknowledge and thank Rachel Shelton, who is an implementation scientist, really expert in implementation science theory and frameworks. I think that is critical to have on each implementation science team. Someone who is up to date and really can think about how do we advance implementation science with this study. So those are some of the key players on our teams.
Great. And as a segue, basketball, it sounds like someone, at least as part of this panel, has a vested interest in what continues to happen this week at the conclusion of, well, it'll now be April Madness. But Stephanie, you're next. There's my segue for you.
I do indeed have a vested interest, Sydney. I'm so glad you used the basketball analogy. I love basketball myself and love playing it too. So I completely agree with you. And I too really embrace the MPI mentality, and having 2 point guards, if you will, at the helm is worked really well in our experience. And, if we keep with that, I think a center player, somebody who kind of holds the fort together and is right under the basket and kind of can connect to everybody on the team is essential as well. So that might be your kind of multidisciplinary trained person who's got, both expertise in behavioral science, but also really has a grounded understanding in theories, frameworks, and so forth. So I would maybe just add a couple other things to what Sydney said. Scientifically, I think you've hit on a lot of the types of folks who should be represented on the team. But I would say that one thing that I've really learned has boded well for our work is embracing this with a system science lens and really thinking about the integration of implementation science and system science as a way to appreciate and even quantify and clarify the complexity of the settings in which we're trying to implement evidence-based practice. Lots of great tools from the system science world that we're using to enable us to better think about implementation. And I think that has really advanced our thinking, and it's helped us have a much more in-depth appreciation of the systems where we're working. And then philosophically, you mentioned the community perspective, the patient and caregiver perspective, couldn't agree more. I would also add really thinking broadly about bringing in diversity, both in personal background and training, but also across institutions and departments to teams, and really thinking about, diversity in rank and the seniority of the folks at the table. Having, energy from new investigators, I think, is really important. The last thing I'll say is creatively, I recently read on Twitter that every team should have a music or a theater major on it. I couldn't agree more. I think we really need that creative, out of the box energy, and I'm a theater major, so.
I love that.
Yeah, I was going to say, does a minor work at all?
Yes, of course it does. Of course
Okay.
it does.
Okay, gotcha. So yeah, major, minor, interest, facility with some sort of performance art. Awesome. So Taryn, yeah. So please, and anything that you'd like to add to the conversation. Community has come up multiple times. Obviously, that's been a strength of your work around childhood obesity. But yeah, what do you want to add?
I want to just say I love the analogy that Sydney gave, and that he went first, because we also have champions at our childcare sites that are embedded. And so that same concept goes across multiple contexts. And I think that's really important. We also have advisory boards that go project specific or across projects that are designed to be multi-stakeholder represented, all the way from parents to agency administrators. So I think those concepts are really important. If I were going to add a sixth player to Sydney's team, then it would be an implementation support practitioner. I think that that's a really important role that we have on our team, and they're employed by our research institution, but they kind of span the gap, and they act as facilitators and coaches for us in childcare sites to support implementation. And their role is so critically important because they need to understand implementation science and concepts. They also need to be super relatable in the field, and they need to be able to do relationship and rapport building in an effective and rapid way. And I had one of these individuals on my team who was retiring, and I thought, oh golly, I'll have to close up shop. She's so critical to our team and the work that we do. So what will I do? And what we had her do was take a strengths finder assessment, identify where she was strong, and see that, okay, she has these key relational strengths. When I hire her role again, I want to design an interview. I want to design a position that meets and matches those strengths, which is exactly what we were able to do, and a strategy that's worked well for us in terms of building the team, as knowing what you're looking for as you're identifying those folks. One other thing I'll mention is that we often have success sharing the skill sets across teams. So that mixed methods person, or your qual person, or whatever, your cost person, that person is not going to be able to be fully funded on any given project. So we try to really strategically across my projects, but also other implementation science colleagues I have, share those special skill sets so that we can each have fully optimized teams.
Awesome. So I really appreciate that each of you went with a particular analogy, expanded it, absolutely can go to the 6th, the 7th, the 8th, through to the entire bench, and within each player or within each person, the many different types of expertise that they can bring. So thank you for that. Encouragement again, and I'm starting to see it for folks in the Q&A to start putting in your questions. So please do. In fact, there's a very specific one, Taryn, in follow-up around whether there's standard tools available for the Strength Finder assessment that you mentioned. So maybe that's something that we can put in the chat. But while we're seeing these questions come in, I do want to see if you might be willing, each of you, to share with us just reflections on past teams or current teams that you've developed and some of the sort of successes or challenges that have come in building those. So up to you whether you want to focus on the positive or you want to focus more on the learning, also positive, the challenges that you had that became learning. But maybe we can start with Stephanie and then Taryn and then go to Sydney.
Sure. Well, you know me, I'm a total optimist, so I'm going to go with the positive. And I'll talk about a really wonderful team that I've been leading with Don Rosenstein at UNC, who's a psychiatrist and directs our comprehensive cancer support program. He and I have been working together for, gosh, I don't know, 5 or 6 years now on interventions to address financial toxicity in cancer survivors. And, you know, we started with a few team science meetings around the problem of financial toxicity probably 8 years ago. It was a substantial issue in our hospital. You know, UNC is a safety net hospital as the primary public cancer center in the state of North Carolina. And so we see a diversity of patients, many of whom who didn't have insurance or who had insufficient insurance and had trouble with their cancer care costs. So we started coming together, and through those conversations, the more we started to really appreciate and map out the problem of financial toxicity, the more people we brought to those conversations. So that would include, you know, not just Don from, you know, comprehensive cancer support and psychiatry, but medical oncology, you know, our oncology pharmacy, supportive care programs, folks who had expertise in racial health equity and rural health equity, you know, social workers were at those tables. And of course, you know, patients, providers, and, you know, financial navigators and the folks on the billing side who could provide that like frontline real world perspective. So initially we collected a lot of data and really tried to understand through a mixed methods approach the nature of the problem, its complexity, and then contextual variation across, you know, care settings, not just at UNC's hospital. And then we used some of those data, including, you know, in-depth interviews, to develop process maps. So a system science tool to really understand how patients and their caregivers were navigating the financial aspects of their care. And that contributed to us identifying financial navigation as the intervention that we were going to pilot test. And then now we are expanding, implementing, really adapting for rural care settings and other types of care settings outside of UNC's academic center. I would say that one of the most recent successes in terms of expanding that particular team was the addition of Sarah Birkin to the investigator team. She really brought expertise in organizational behavior and readiness for change that I think has completely augmented how we think about moving this kind of intervention into very diverse practice settings that are in very resource constrained and sort of fundamentally different rural environments.
Great, thank you for that. Taryn, your thoughts about successes or challenges?
Well, sure. So I've seen a couple of questions about that Gallup assessment. So I put the link in the chat. So Shelley, and I missed who the other was, but if you scroll back up in the chat just a bit, you'll see the link there. So I am not quite as positive as Stephanie. So I have both. I have successes and challenges. I would think one challenge is because of what I mentioned of trying to keep people across multiple projects and working in a soft money world. You always have to be kind of churning that grant wheel, and you have to be really being careful about finding the skill sets that you need and keeping them funded and in a stable way. So that's been a challenge. I would say also training for staff. So we know that we have a training problem in implementation science for faculty. there is a backlog in terms of the capacity that exists to train the people that are interested. But if you go to other layers of a team, so the other team members on my staff, for example, that do implementation support work or other roles in our team, finding training for them is also a challenge. And so we've had to get creative about how we do that. And so a couple of the things that we've done are use the Center for Implementation Science. So the TCI has a number of training opportunities that you can purchase. And we've used those as kind of launching points for internal journal clubs so that our staff and our team can have shared knowledge and language around implementation science concepts. I've also had a team member, Daphne Golden, she may be on today. She has been really involved in CARDIS, and that's the anti-racist group within implementation science. They've been doing excellent work, and she's had a leadership role with that group and been able to get kind of field experience and on the ground training as an opportunity there. So internal training, internal journal clubs have been a success that we've tried to leverage to meet that challenge. One other thing that we do is we have a team onboarding process where we have a team glossary of implementation science terms. We have all of our project protocols and descriptions, and we try to get people as up to speed as we can, as quickly as we can, with kind of a standard onboarding process. So all of that seems to help us build our internal capacity a bit.
That's great. Sydney, your thoughts?
Sure. So I'll start with a challenge and then end on a positive note with some successes. I think a challenge that I faced during my K award was that my team was too big. I had 3 training goals, and I had 3 or 4 kind of mentors or consultants in each of those areas, which led to a team size of about 12 people. And it was impossible for all of us to meet together. And so I think, especially, I know we're going to talk about, early career investigators or early stage investigators. It can be hard to meet with an entire team, especially when you're working with more senior people whose schedules are so busy. So I think one of the successes or lessons learned from that is being willing to have a lot of one-on-one meetings and kind of small group meetings, and then we quarterly now have a meeting with the entire team. So I think an early challenge is really thinking about what roles are absolutely critical for your project, and making those roles kind of the bare minimum so that your team doesn't get too big. I think one of the successes that led from that early experience was, as you transition to my R01, I actually brought in an organizational consultant to assess our team dynamics. So we had, folks from Columbia's business school. I was at Columbia at the time, who interviewed all of our team members, interviewed members in the community. They created assessments for us. They did, gave us recommendations about our strengths and weaknesses, basically gave us a SWOT analysis. That revolutionized how we conducted our teams and really transformed the research process. And one of the key things that we learned from that process was that, we worked with a lot of graduate students who did our assessments, but they didn't see any way in terms of mobility. And all of our work is focused on health equity. And so we certainly wanted to make sure we were creating equitable practices with our team. So now we make it a priority to try to hire our grad students to be members of our team, which they love because it's a big learning experience for them. It's an economic, boost for them. And so that was a direct result of our work with this organizational consultant. I think another success was really embracing community voices. I think some of the challenges of community engaged research is that it can get messy at times because there's so many different voices, but we have just really learned to embrace and trust that process. And inevitably, it led to better implementation outcomes, and we hope it will lead to better clinical outcomes for the participants in our studies. So those were some of our successes.
Great. Again, thanks to each of you for those wonderful comments. So I do want to pull up a couple of questions that I think are in follow-up to several of the things that you've already said. And so in a sense, maybe you can help me by who wants to take this particular, these particular questions. So the first one, I think it came up a couple of times, this idea of using the multiple principal investigator, the MPI role. And someone wanted just some clarification for anyone who would like to weigh in on what is the MPI role on these teams? How do you sort of share leadership, or how do you envision the multiple PIs working together? And who wants to start with that one?
I'm happy to go first. So both of my current NCI R01s are MPI directed. One is with Dr. Rosenstein, psychiatrist, and the other is with my medical oncologist colleague, Dr. Katie Reeder-Hayes. And in both of those cases, I would say that having the PhD, MD partnership has been absolutely essential to making sure that the work is both methodologically rigorous and grounded in, the PhD training and econometrics and behavioral science and implementation science that I bring, but really is clinically very relevant and actionable and addresses the specific needs of the patient populations that we serve. And I really think my clinical colleagues bring that to the fore. In terms of what that looks like, I think really spending time to engage with an MPI before you jump into this marriage is critical. And in both of these cases, I can say that, Katie and Don and I have worked together for many, many years before we wrote a large grant together. And we kind of knew how each other worked. We had very similar working styles. I think we gave a lot of thought to the MPI plan and how to navigate that together. But I will say that, with both of them, we sort of finish each other's sentences at this point. So there's not a lot of day-to-day navigation of roles and relationships, but that comes from trust, that comes from shared power and mutual respect and authority and an appreciation for the same values. So, equity is at the center of all of our work. Community voices are at the center of all of our work and really trying to improve access. So I think if you have those things, then you're in a pretty good MPI place.
Perfect. Taryn, Sydney, do you want to amplify anything?
I think one of the benefits of an MPI model is that it can help more junior investigators really have a leadership role in partnership with a more senior PI. And so for my first grant, first R1, it was. So I was more junior at the time, and the more full professor, Elijah Williams, he really gave me the reins, and he really let me shape the project and the study as if it was kind of my R1, and he would intervene when I reached out to him for help. And so it was an amazing learning experience. And then we got, as part of a P50, another R1 level project where he's contact PI and I'm, multiple PI. And so we kind of reflect those roles. And so it's just, to Stephanie's point, takes a lot of trust, a lot of communication, and it really can amplify the work.
Great, thanks. Taryn, your thoughts?
Yeah, I'll add something briefly. I have an MPI NCI funded R21. And what was neat about that collaboration was that we are both working in the same context, but with different interventions. In fact, a lot of people might call our interventions competitors. But what is cool about implementation science is we can collaborate to answer really interesting implementation science questions across the different innovations that we have. And that was able to pull together, geography, we're working very different places, and these different interventions. So we can be part of the same team and working toward a common goal, even though our interventions might be considered in other realms as competing with one another.
Awesome. So there was a related question also about MPI, and thanks to the questioner for extending the basketball analogy even further. So the idea that each of you raised was, as you're thinking about the constituent members of your teams, sometimes you're thinking about economists, you're thinking about methodologists, whether it's qual, quant, mixed methods that are often used across projects. But the questioner is asking whether you talked about sort of MD, PhD as one way to try and think of partnership, but do you ever consider some of those other specific experts that are part of your team as really being beneficial as MPIs on the team? And the basketball analogy comes in where sometimes as the questioner says, it seems like those skill sets may be seen as playing a lesser role, say sitting on the bench, as opposed to being able to have as many minutes as they should, given their expertise. So anyone want to weigh in on sort of MPIs of complementary or particular methodological or content expertise?
Well, I'm happy to start. I mean, I was trained in econometrics, and my start in public health was really designing cost effectiveness models, and I was a methodologist first and foremost, and that's changed over time. But it's a tension for people who have very specific methodological expertise. You often do get pulled in as and seen sometimes and cast as a one-hit wonder and like a very specific type of player, the pinch hitter. You don't get cast as the shortstop or we're changing metaphors now, by the way, in sports.
Spring
But
training, so that we're good, right?
right, it's time. But I think that can work too. It really depends on the science. It really should be driven by the questions that are being asked. And at least in the space that we work in, access is fundamentally, in my opinion, mediated through finances and through people's income status, their social vulnerability, their access to insurance. So when we talk about really improving equity and access to healthcare, you have to deal with the money. And so having an economist at the table or a decision scientist at the table, and sometimes at the front of the table, kind of leading the discussion, I think makes a lot of sense. So I would say, it comes back to what game we're playing as to, who should maybe be directing the group, the team.
Sure. So it could be tennis too. Who knows? Other thoughts, Taryn or Sydney? Do you want to add in just around other uses, other ways of conceptualizing MPI role? Other sports to throw.
Golf. We got to get golf in here somewhere. That's my sport. Not a team sport though, huh? It doesn't really work today.
Totally is a team sport. The caddy is invaluable.
Okay. Thanks, Sydney.
Yeah.
There's physio, there's swing coaches.
Right. It is exactly everything outside of being on the links.
So Taryn, I do have there was a specific follow-up from something you said. It seemed like you piqued curiosity around this idea of what seems like competition among different programs, and asking whether you might speak a little bit more about how you've worked collaboratively with a program that might be seen as competitive, even how you sort of shape that negotiation.
Yeah, so the research question is about an implementation outcome. So we're really interested in sustainment of these two different programs, and they're at different points in their life cycle. And as I mentioned, they serve different geographic and racial ethnic audiences. So we wanted to study them in parallel and kind of understand what is predicting sustainment or lack thereof of each program. So the research question was not framed to advance one program or the other, or even study the effectiveness of one program versus the other. We're not comparing the two programs in that regard, or instead trying to understand things about a really important implementation outcome, which is sustainment. And I think that kind of thinking and framing of your implementation science questions is possible with a range of different outcomes that you might study: fidelity, adoption, capacity to implement. There's all kinds of interesting questions that we can ask if we'll think just a step bigger and not be innovation specific. If we can try to pull different innovation creators together to ask implementation questions that span different innovations and context, I think we get more generalizable knowledge, or I hope so.
Mm-hmm. Awesome. I think this is a question that seems to follow up, Sydney, from something that you had mentioned, just in terms of how you manage meetings, right? And this idea of one-on-one versus teams, and if you have extensively large teams, how we make that work. And so the question is how you handle the aspect of different people who might be missing meetings at different times, maintaining communication of project process, whether it's that there's this sort of attempt, maybe we can record, maybe we can encourage those to listen in, but it doesn't always happen, or it might not be possible in certain meetings. So how do you navigate the communication, and then others feel free to weigh in, but that issue of availability of a team?
Yeah, no, thank you for that question. I think that we've had to become very clear about what is the purpose of each meeting, and then who should be there. And that really dictates who's going to be invited, And if a person is critical to being at that meeting, then it's really sending out a doodle poll, figuring out when folks can meet, and making sure to keep people accountable, really, to those meetings. And so one of the best resources that we've used for teams and for meetings is by an organizational kind of leadership and consultant expert named Patrick Lencioni. He wrote a book called The 5 Dysfunctions of a Team that I think is a must read for anyone interested in implementation science, because he meticulously kind of goes through what brings teams together and what leads to kind of ineffectiveness with teams. And so I think that can be a great resource for everyone to think through who needs to be at meetings, how to structure them based on what is the goal, what is the objective, what are the key deliverables that we want to happen at the end of this meeting, and then really creating a culture and processes by which you keep people accountable.
Great. So Stephanie and Taryn, your thoughts about just managing meetings and attendance and that kind of thing.
I read that book this year as well. It's a really good one. Recommend it. Put the link in the chat. Just two more things I would add to what Sydney was sharing, which is advanced scheduling. It is almost impossible to get meetings on the calendar. And so we scheduled for the whole year in advance, because that's the best chance of getting everybody there, is getting it on the calendar early. The other thing is, that I would build on to what you said, is sending ahead what's going to be discussed, but I like to frame that in terms of the driving questions. These are the questions we're coming together to answer during our time, so that people really feel like they are contributing to a discussion, and that their contribution is valued and meaningful. So those would be a couple things that I would add about meeting management.
Perfect. Stephanie?
Yeah, great points from these guys. And I now have a reading list over here that I've started to compile. So thank you, Sydney and Taryn. So I think, one of the things that we have done is have smaller working meetings and really try to be intentional about, a small working group that is focused on weekly tasks. And they're kind of always using those meetings to not just have a conversation and give updates, but really actually do some of the work during the meetings. Like we'll, take notes and work on surveys and things like that in real time. And then only having maybe a large group meeting once a month or once every 2 months if we don't need that check-in on a more regular basis. And so that larger group meeting then serves for some as more of an updating opportunity and a strategic thinking opportunity, but all of the task-oriented actions are happening in these more frequent, smaller groups. So that has worked really well. As these guys said, having very clearly defined agendas with action items always noted in those agendas, and those minutes go out to the people who couldn't attend the meeting. Increasingly, I am feeling like a meeting for the sake of a meeting, just to give updates and to talk, is not a good use of anyone's time. And so as much as possible, and I do this with my students as well, I try to make every meeting a working meeting. Let's actually get some of these tasks done while we're together. And one of the things we've used most recently that has worked particularly well in several of my teams is having writing meetings, retreats where we come together and we have specific writing tasks, everything from abstracts, to full manuscripts, to sometimes, briefs and things like that, infographics that we're putting together, where everybody has an assigned task and we come together, in the joint group accountability of being there in the same room with all of our laptops is very effective, and it's very productive. So I'm in favor of that over just meetings for the sake of meeting.
Yeah, no, that's really great. You can see that there is now a dog in front of a fire, but keeping a safe distance so as not to have any particular adverse outcome. Yes, these are the fireside chats, so hopefully if you need it, you get a little bit of warmth emanating as this dog is from this picture. Thanks to everybody so far, by the way, for these wonderful questions and really picking up threads that are already in the conversation and moving them toward these great pragmatic suggestions. So I do want to touch on another thing that often comes up when we hear about folks who are trying to pull together teams, and that's just certainly not just across disciplines, but across different roles, different responsibilities, different levels of expertise and experience, is this notion of language, of shared meaning, of terminology. All of you obviously are not sitting in a lab. You are very much working with hand in hand with communities, with systems, et cetera. So I wonder if each of you, and maybe we could start with Sydney and then go to Stephanie and then Taryn, could talk a little bit about how you consider, how you prioritize, how you think about language, trying to establish shared meaning, terminology. We've certainly found that some terms do not work very well in certain contexts and others work really well. So your advice, your experience on that would be really awesome.
Yeah, no, thank you, David. So just to give some context, again, my work is really focused on depression in partnership with African American churches. And so two words are particularly off-putting in that context: depression and research. And so we have really relied on our community advisory board to help us navigate how to frame both of those topics. I think starting with research is much easier. Everyone certainly knows the egregious acts of racial injustice that have happened to African Americans at the expense of research. And so we talk about that openly. We acknowledge those injustices when we have forums, when we meet with pastors. We acknowledge how harmful research has been in communities of color. And we commit to working with them to not commit those acts. So I think being very transparent, acknowledging some of the issues, the hot button topics, the distrust at the outset was helpful for us gaining the trust and respect, of those pastors. And I think secondly, we talk about depression. We really were very intentional about on our promotional materials to not specifically say the word depression. We use words like stress, which everyone in New York City can relate to, anxiety, and especially over the last 2 years, COVID-related loss, because so many people, especially in Harlem, were impacted by COVID and know someone personally who died as a result of COVID. So that is what got us in the door. And then during the process of, meeting with prospective research subjects, engaging community members, and telling them more explicitly about the study, we said, given all of the stressors, given everything that has happened, depression can be one of those consequences. And so that's how we got to depression, and that's how we talked about research, in this specific context.
Great, thanks. Stephanie.
I think this is such a critical question, and it requires, on the part of researchers, a cultural humility and an openness to recognize that our terms can and should change, and a recognition that the ways in which terms and language have been used historically has not always been with an intentional mindset and using a racial equity lens. Recently it came to my attention that the use of the word stakeholder is potentially offensive to many of our Native American communities. And the reasons for that are very clear. The colonial heritage and history that was experienced in those communities, it's understandable why a term like that may be concerning. And so as a researcher, I think we have to continually be open to educating ourselves about how these terms are felt, what the impact is, not just our intention, but the real impact. And I would point to a resource from the CDC that I'll put in the chat around language, and how to really talk about some of these things in a way that is more culturally humble and appropriate, that I think is a really helpful guide. And I would say that we have to also give ourselves, some patience, and give ourselves some space and some freedom to figure this out, given that it is a dynamic issue.
Mm-hmm.
Great, thanks for that, Taryn.
As I mentioned, internally we've found the need that we needed our own glossary so that new team members can get up to speed on kind of some of the things that we're talking about. I want to echo what Stephanie was just saying exactly about the term stakeholder. When we learned about that, and I wish I'd written down the beautiful quote you had about, being willing to change our language. When we learned about that, we went to our groups that do provide community input and asked, what do you want to be called? I realized we'd never asked that. And they decided community partners was more of a pleasing and preferred term. And so that language shift is one we made with their input. And I meant to say this a moment ago, liberating structures is a way that we approach some of these conversations with our community partners. And we use, I think that they'll be putting that link in the chat, but there's some really structured ways that you can increase the power, level the power playing field to have some of these sensitive conversations. So I think that's a good strategy to use. And just while I'm talking, I want to mention a couple things that I meant to say on the meeting piece, which is, in addition to writing days, which I love that idea, it's so great, we do theme days. So what that means is in our virtual space, we used to work together sometimes, and we can't do that virtually, but we'll get on the Zoom and turn our mics and our cameras off, but just know we're all working on XYZ project today, and we can unmute and chat about it if we need to. It reduces email and provides a shared working space that we call Gear 5. So I read last year, thinking of our reading list, a book called The 5 Gears, and it talks about how we use time, and Gear 5 is deep task time. So we schedule it, and we have these theme days around it. But we also have Gear 3 time, which is social time, and we schedule that, and we have light time together, and we have Gear 1 time, which is just you alone with yourself, So that's been really helpful language for our team to use to say, I can't do that, I'm in Gear 5, or I really need a Gear 3 connection. How is everybody doing today? So that's been a common language for us to share that we've really appreciated.
Great. So I'm seeing another set of wonderful questions coming in. And one of them, I think, specifically goes back to the connections with community advisory boards, community partners, et cetera, and just ask the fundamental question of how your partners learn about implementation science. What's that linkage that you've had to bridge just to get folks on the same page as to what is the agenda for what we're trying to learn? Anyone want to take that one?
I don't mind to jump in and say, sometimes we just try to frame the problems as simply as possible. So here's the intervention, here's this program we'd like to do with your site, and here's some things we've heard that make that hard to do. Help us solve that problem. And we don't use words like innovation, implementation strategies, context, frameworks. We just don't. You don't have to go there sometimes. So my simple answer would be keep it simple and straightforward.
Anyone else want to add in quickly?
I couldn't agree more. I mean, I think we should almost never use the implementation science language of academics when we're in the community. It just doesn't work in my experience. So Taryn, you're right on.
Yeah, well, it sounds like, again, what each of you have said of just trying to find the shared meaning. And so if you're coming from a perspective that just doesn't resonate, whereas, in theory, with some folks who might envision laboratories in a certain way, extending that, knowledge to what would a laboratory look like for implementation may be useful, but to many others, laboratory, not a good thing to hang one's hat around. Cool. So another question pops up and just asks, actually, there are a couple of questions that I think, Taryn, you had mentioned the idea of an implementation support practitioner as part of your team. And so maybe just any quick thoughts about what the background or training of somebody who's interested in that work. Are there certificates or resources that you would point people to?
Again, the TCI has some good certification opportunities. Maybe certification is too strong of a word, but some really good modules and training opportunities. But for us, what's most important is that the people that we're hiring to do those roles have experience in the context. So I do work in childcare, so I like to hire retired teachers or people that have been in the education context before, or community organizers, or people that really are familiar with that on the ground work. So I would say that that's the most important thing, even beyond implementation science knowledge, is having that context expertise.
Okay, great. So I do see one question and then I see that Cindy has done a really nice job of including some tools for those who are interested in teaching implementation science to a broad, concepts to a broad audience. So maybe that's a way to recognize, appreciate, and maybe provide a partial response to that question, because I do want to move to another one which comes up a lot. And each of you have sort of traversed from that sort of earlier career investigator stage to mid and senior levels. And so the question is, what advice you have for early career investigators who are wanting to work in implementation science, sometimes have concerns, whether it's about their expertise or are actively told it's really too laborious to try and establish a team. You got to figure out how to do certain things, get to a certain point, and then you can think about that kind of collaboration. So advice that you have, maybe we can go Sydney and then Stephanie and then Taryn.
Sure. So I think one of the best pieces of advice for more junior faculty would be to consider working with a leadership coach. I think really at the essence of implementation science is strong leadership because you're working with such a multidisciplinary group of experts that it's important to be aware of your interpersonal strengths and weaknesses and how that could impact, team dynamics. I know one of my struggles as a early, career investigator was I avoided a lot of conflict, among the team and then among some of my community partners. And that led to problems, and I worked with my leadership coach to be able to recognize or anticipate areas that may be conflictual and then bring people together to address them head on. So I think one of the things that is difficult for junior faculty to realize is that there are politics when working with more senior faculty, because we just want to do good science and we just want to help the populations that we care about. But understanding some of those interpersonal and professional dynamics, I think, is invaluable as you think about entering into building an implementation science team.
Great. Stephanie?
Yeah, so I have a couple of thoughts to add to this. I mean, I think that the one thing that's absolutely critical is mentorship, and I would say diverse mentorship from a variety of people. I'm a firm believer in the mosaic mentoring model, that you get different strengths from different people who sit with you and kind of help coach you through your career. And, some people may be your life coach mentor, and some people may be your content area mentor, and others may be your methodological mentor. And then you probably need somebody who's just a big picture thinker and can help you strategize about where you want to go in your career. Sometimes these are the same folks, but usually not one person can do all of those things. So really seeking out a diversity of mentors, and not just the most senior people in the field, but also peer mentors, horizontal mentors, and then diagonal mentors, people at other institutions who might be, in a different position than you are, a different rank than you are, that can provide an external perspective. And they shouldn't all be implementation scientists, I would say. The club of implementation science sometimes feels exclusionary. I know, David, it was never meant to be that way. But as a starting scholar, it can feel that way. And so making sure that you've got other folks at the table, who can really reflect the larger complexity of the public health arena we operate in, I think is key. The other two things I would say is embrace training opportunities. Attend the annual D&I meeting. That really helps to expand your vocabulary. It certainly has for me. Join one of the training programs that exist, whether it's the Institute for IMSCI Scholars or any of the others. We named a couple that we've been a part of. We also have a scholars program through the Cancer Prevention and Control Research Network that's in its second year that I would strongly encourage people to consider joining. These are the kinds of things that are going to, really start to build your vocabulary. Of course, the TIDIRC resources as well are super helpful. And then the last thing I'll say is, as a junior investigator, build a CAB. Identify a community liaison, at least one, ideally more than one, who can give you the real world on the ground perspective in the area that you're working in. A community engagement liaison can help with that. At our community outreach and engagement office, we have a senior community health educator who is expert in building CABs and sustaining and engaging CABs. And I think that she alone has transformed the careers of many junior investigators who didn't know where to start with really getting that external community input.
Awesome. Thanks, Taryn.
I'll highlight in just a second a few points. I also got a coach coming off my K in Sydney that was extremely helpful. Highly recommend. I want to double down on the piece about group and peer mentoring. Dr. Eva Woodward and I have provided that for one another and others back and forth, and it's just a wonderful thing to have in addition to great mentorship at a senior level. I would say that the barrier to entry is high, but don't let that stop you. You have to start where you are, figuratively and literally. So a lot of, there's not a deep bench when it comes to the top level of implementation science. So you don't have to start there. You can, broaden who might be accessible to you to help support you as you get started, and be really strategic about your asks when you have those initial meetings with potential mentors. Make sure you are working to get some of this language under your belt. And I've asked Cindy to share some of those, I think, foundational implementation science readings in the chat about where am I on the pipeline and what is the thing and what is the strategy. There's some great stuff you can read to kind of get your feet under you, and then go to those potential mentoring meetings with clear understanding of what you would be asking of them. I think that those would be helpful ways to help you get your foot in the door and get going.
Yeah, thanks to the three of you for all those comments, and thanks. Cindy's been populating the chat, so if folks don't have that chat window open, please do make sure that you take a look at all of the different resources. It's sometimes in response to some of the questions that have popped in. And yeah, Stephanie and Taryn and everyone who's been able to amplify various points in the chat is great. Seeing that we're just a couple of minutes before the top of the hour, I just want to ask one final question, which actually comes from one of our attendees, that talks about what the word expert means to you, and how the panel justifies who's an expert and how you think about the expertise of your team, where expert, as the questioner mentions, can be a poorly defined concept that we assume we know what it means. So maybe a quick sense of how broad, how specific, how do each of you think about the word expert? Maybe we can go Stephanie and then Taryn and then Sydney to close us out.
You had to start with me with the hard question. I take a very broad and inclusive view of this term expert. When we're working with community partners, I view and refer to them as community experts, because they have specialized knowledge about their community that nobody else has, on the research team. So I think expert carries a certain weight to it, a certain kind of superiority to it. And for that reason, I try to use it equally when I think about community experts, partner experts, in the same way that I do methodological or content area experts.
Great,
we
thanks.
have an expert advisory board that includes all of these folks, and they're all experts. So
awesome. Taryn?
For me, since coming to implementation science, my favorite kind of framework has been IPARIS, because especially in the original iteration, it really emphasized the importance of local evidence and how what you know about your place is expertise. And so I agree with what Stephanie's saying 100%. You are the expert in the life that you live, in the things that you do in your job. When we're trying to get people to change their behavior within organizational constraints, they're the experts. And so I would say inclusiveness in that definition is key for our work.
Great. Sydney?
Really want to emphasize the local aspect of expert, and that especially given how much organizational culture impacts implementation of our interventions, really having local experts is vital. And so I have a very broad definition, I think, of the word expert.
Well, thanks to the three of you for just showing why, of course, we wanted to have this discussion with the three of you, how much wisdom, how much expertise in all ways you've been able to provide us. And thanks so much to everybody who's asked these great questions, who's listened, who's provided your feedback, and keep the conversation going. As always, we appreciate hearing any feedback, any suggestions. And the archive, as you can see here, will be provided. But maybe I'll turn it over back to Anita, but with great thanks to Sydney, to Taryn, and to Stephanie, in the order that I see your faces smiling on the screen, for joining us today. So Anita, do you want to close us out?
Yeah, so thank you to our speakers for a great conversation today. As a reminder, an archive of today's session will also be available shortly. Thank you again, and you may disconnect at this time.